Hiya, this is Physiological and Psychological Response to Sports Injuries by Michal Kazimierzczak. So, the introduction. In this presentation, I will cover the physiological response to injuries, psychological response to injuries, and common treatments for different injuries. Signs and symptoms. So, when you injure yourself, you go through various physical and mental things. So, the signs are most commonly bleeding, bruising, swelling, unconsciousness, and you can see the bone if it's an open fracture. The symptoms are pain, dizziness, feeling sick, tingling, tiredness, and stiffness. The initial response to injury is the inflammatory response. So this happens very soon after the injury happens. It also appears when the tissue has been damaged. The damaged cells release chemicals that then cause swelling to protect the injury. The blood supply is increased to help with the repair of the cells. And then the white blood cells will eat any dead cells, and platelets will then clot the blood, meaning the bleeding will be slightly reduced and eventually stop. The physiological responses. Pain. Pain is probably the first symptom that you experience. This is a way of your body telling you to stop what you're doing. Naturally, your body will stop to prevent a further injury, and swelling will increase the blood flow. Therefore, there will be more pressure on the nerves, and the pain will occur. Swelling happens shortly after the injury. So this is caused by the fluids going into the injured area. The fluid that goes into the injured area contains white blood cells, which can prevent infection. And it will also drain the chemicals causing pain, and the tissue fluid will start to form around the area. Redness of skin and heat. So the skin colour will, around the area will start to look a bit red and feel hot. This is because of the increased blood flow to the injured area, so that the injury can actually heal properly. Reduce the range of movement, so your body will not allow the movement because the body will not allow any more movement as it will be feeling pain, and it will not allow movement because of the swelling around the injured area. The repair phase. So this stage happens about 5 days after the injury and usually takes around 4 or 6 weeks. There is an increase in fibroblast activity, which can cause an increase in connective tissues strength inflammation. This is important. It's important that the person that starts to move the joint have full range of motion as soon as they can ensure they don't limit their movement after their injury is healed. If the person cannot physically move during this stage, or they're too scared to, the fibroblast will lay down scar tissue on the damaged tissue. This will cause the muscle fibers to cling together, as well as connecting the connective tissue to muscles and joints. This will cause very painful and limited movement. On the other hand, if you complete a full range of movements, you will break the microfibers, and the other tissues will be broken while the original fibers become stronger. The person injured might experience pain on and off depending on the position of the joint, and you then know you are in the repair phase. The scar tissue. So at first it will be random and won't be stretched for a few months. When the new scar tissue forms, it will form parallel lines, giving it strength. The length of the time to repair the tissue can depend on the size of the injury, place of the injury, and the types of tissues that are involved. The remodeling phase. Light strengthening exercises can begin after 3 to 4 weeks after the injury, increasing each week, so the pain should only be felt in certain activities, and this phase can take anywhere from 6 months to a year, and the joint should be stretched to its full ability. Injuries and psychological responses. So a muscle strain. So strain can happen to either a muscle or a tendon. There are 3 grades to a muscle strain. So grade 1 is a mild strain, and there's only some muscle fibers damaged. Grade 2 is a moderate strain with a more extensive damage on the muscle fibers, but they're not completely ruptured. And grade 3 is where there's a complete rupture in the muscle, and surgery is often needed to fully repair the damage. The damage response to that would be there will be an inflammatory response to the injury which lasts from 3 to 5 days, and the body will remove any dead muscle fibres in anticipation of the healing response. There will be a regeneration of the muscle fibres, so they will grow from the cells in the muscle. There will be a scar tissue formed from the bleeding in between the torn muscle ends. This will cause a scar which will make the muscles more resistant to damage. Maturation of the scar tissue. This means that the fibres that make up the scar tissue will become aligned and be able to deal with more force. A ligament sprain. So a ligament attaches bone to muscle. There are 3 grades again. So grade 1 and 2 are less severe. The ligament remains intact. There's no damage, but there's some damage to it. And grade 3 is when a ligament is completely tears, and there's commonly referred as a rupture or a tear. The damage response to that is in the primary response. The body will produce chemicals and bleeding in the tissue. This will cause swelling in the joint. The healing response will be blood clotting, so the blood platelets will form a mesh over the damaged tissue, and the fibroblast cells help lie down collagen tissue in the blood clot. Scar tissue and remodeling. So the scar tissue remodeling is also present in the healing response. It can last up to 1 year, and is the strengthening of collagen tissue produced during the healing process. You shouldn't put a lot of force on it, but make sure that you take part in physiotherapy and strengthening exercises. So hematoma is a collection of blood in the body tissues and cavities seen as bruising in the skin, and is most likely caused by internal bleeding in extra cellular space after injuries, falls, or different. The damage response is inflammation around the blood, so can be treated with pain relieving medication, and you're recommended to rest after the injury. Psychological response to injury. So anxiety is one. During the healing process of the person, they can feel anxious. They might think that they won't recover the post-injury form. They will feel weaker physically, and where they're actually not, and they feel like they won't recover and be able to play the sport again. Depression can be caused by an injury. As many athletes grow up playing sport and nothing else, they cannot play for injury. Therefore, they will lose motivation, energy, and will withdraw from society. Isolation. This can occur when the player has to be isolated from the teammates because of rehab, etc. This can cause psychological problems, and they might not feel as a part of the team. So the different rehabilitation responses are frustration. So suffering a long-term injury can cause frustration because the athletes will create competition because of their competitive personalities. An injured athlete might need the motivation to keep focused on recovery, and this will be achieved by goal setting. Goal setting can be crucial in recovery from injury, as it can help the athlete keep the athlete motivated and focus on to a particular level of fitness. First aid application to injuries. So in a dislocation, you would tell the player to stay in place, place something soft between the arm and the side of the chest, and wait for emergency services, and before you popping the shoulder back into place. An open fracture, so you will make sure to not move the injured player and stop the bleeding by applying pressure to it. You will put the fracture into a splint to minimise discomfort and apply ice to reduce swelling and pain. If the athlete is experiencing shock, then you have to lay him down and wait for emergency services. For a cramp, so you will pull the athlete to the side and ask them to stretch out the muscle and gently massage it. You will also apply an ice pack to the muscle and relieve any pain. For a sprained ankle, you will apply the rice. So this means rest. So rest the ankle, use any crutches if needed. Apply ice to the injured area every hour for 10 to 20 minutes. Compress the ankle for 24 hours to reduce swelling. Elevate the ankle above your heart for 2 to 3 hours every day to reduce swelling and bruising. And that's it, thank you.